Guys, this is Diane here from Skill Snacks speaking to the students today. I have this beautiful, gorgeous, lovely, I know she looks like a model, but she's actually a nurse. She could be a nurse slash model. I'm just saying. But anyway, she's gorgeous and she's super smart on top of that. Her name is Jessica Baumgartner, and she's a nurse. And what I brought her in today to talk about is to shed some light on the travel slash agency nursing, the good, the bad, the ugly, and of course, the wonderful, the positive, and most importantly, good advice for the students as well. Okay. Hi, Jessie.
Hey there. How are you?
You're here. You're so awesome. I miss this woman. I worked with her before. She's awesome. She's a wonderful critical care nurse. I know you do many other things too. Before we get started, can you tell the students what different departments you work in besides just critical care where I've worked with you at?
Sure. So critical care, as some students may know, have different specialties. I started off at University of Maryland Medical Center in downtown Baltimore on their surgical ICU. Then after that, I did my first travel contract in Charlotte, North Carolina, and I was in the dedicated COVID ICU. I have done general ICUs. I was at Sinai with Diane, which was a mix of everything. Yeah.
Trauma 1, trauma 2, MICU, CICU, neuro ICU.
Yeah.
Everything.
Yes.
Yeah. Okay, so let's talk about it. Let's say what are some of the good things about travel nursing and agency nursing?
Those are very good questions. Made some notes here for the students. So obviously the biggest thing that draws nurses into travel is the money. The money is typically at least twice as much as what you would make as a staff nurse. However, you don't get benefits like health insurance and things like that. Paid time off is typically rare depending on your agency. But the money is always very good. You can also still sign up for some overtime as well. It just depends on the availability of the unit. As far as how much the travels contracts go for, you can sign up onto Facebook travel group pages, and you can see some of the postings from the agencies there and get an idea of what they're going for, what the going rates are.
And then she said this because as you don't know yet, but you'll know when you get into this, but the rates fluctuate with what's going on in the world, like COVID and all this other stuff that's happening. It's up and down, kind of like the stock market, right? This is like the stock market. Okay, so what are some bad things about, unfortunately, travel and agency nursing?
Yeah. So some of the bad things would be the unpredictability of agency and contract nursing. So when you're a staff nurse, you know for sure that you have a job, unless things aren't going well and such. But with agency nurses, you do hear a lot of nurses getting canceled. Their contracts, the hospitals don't have the need for them anymore, so they'll cancel the contracts. Sometimes if you are looking for a specific area, so I have been doing local contract nursing. I'm from Maryland. I kind of wanted to stay here with family. And so that is a little bit of a limiting factor because sometimes I don't see as many contracts available here as I do other places. And then, some of the other things too is that if you are thinking about doing traditional travel, you're going from state to state or area to area, you have to secure your own housing. You have to move there. My first travel contract I did was in North Carolina. I was able to drive there, which was good, but I had a dog, a cat. I had to pack up 3 months worth of items in a little sedan and drive down there. And, that was quite an adjustment. And I forgot some things, some necessary items and things like that. But you have to kind of keep that in mind that you have to be very flexible with that and resilient because it's different units and then also different locations and different hospitals. So
yes.
Yeah.
Oh my God. Bringing back memories now from the traveling part. Yes.
But there's a couple other good things though. But besides the money, the flexibility over your schedule is great. When you sign up for a contract, you can tell your agency or the hiring manager, hey, I need off these dates, or you can take time off in between contracts. So I usually like to take a week or two off in between just so I can give myself a little break.
Right.
And also too, because you do have exposure to different hospital organizations and different units, you come to, first of all, appreciate that no place is perfect. There's always going to be good things, always going to be bad things about the unit or the hospital. There's no perfect place to work. And also you learn so much. You learn how to be resilient. You learn how to be, once again, flexible. And you end up making some great friends.
Yeah, team player, guys, right?
Mhm.
Team player everywhere. Sorry to
Yeah,
interrupt.
for sure. So it definitely builds you as a person and also builds you as a nurse.
Mhm. Awesome. Wonderful. Give the students one tidbit, one word of advice, especially if they're considering going into agency nursing right away, and they literally just graduated yesterday. Like, this agency's been calling me. They know I'm a nurse now. I think I might do this. That's a lot more money than what I'm going to make just coming out. Should I do it? What should I do?
So you really need to have, I mean, it's imperative that you have at least 1 year of nursing. You most hospitals have the new graduate programs in place because there's so much that the schools does not teach you. You have so much to learn, and the new grad programs at these hospitals, usually pair you with a preceptor, a mentor. They have a lot of support. They have a tons of education. So you need to take advantage of that just to get your basics, your foundation. And then after a year, if you feel like you can look into travel. But they give you 1 day of orientation, maybe 2 if you're lucky, on the unit. And you have to be able to know what you're doing enough to where that 1 day, the next day you can take a full load of patients and you're going to be okay. So that really does take a very seasoned and trained nurse, and you don't want to make any mistakes, any medication errors. And you also don't want to drive yourself crazy if you're not ready for that.
Exactly. Because I did discuss that on another video for the students. Yeah, that's important because they're going to give you pretty much a heavy load because they look at the fact that we're getting paid a lot more money than the staff. And if you don't already have that background and can't really manage a team that well, and I don't want to say the term get dumped on, but let's just say get an assignment that really the typical nurse really shouldn't have, but they look at it as, hey, someone has to take these extra patients. Let's give it to the agency nurse. That happens a lot. And if you're fresh out of school and you really haven't gotten your feet wet, that's already going to be an overkill, just getting a basic team. And then you're going to get more than what you really should have. And then if you make waves about it and complain about it, then you look like you're not a team player when really you're just concerned that you're afraid you're going to lose your license that you literally just got. Because you know in your heart this is really an unsafe assignment for you. Even though the charge nurse at that time may not want to hear that, whoever's running charge that particular day. So thank you so much, Jessie, for being here. Oh my gosh, she's so gorgeous, isn't she? Oh my God. I miss seeing you every day.
You too. You're wonderful. And if your students ever need any kind of resource, if they ever have any questions, give them my information. I'd be more than happy to help them be prepared for their first assignment if they do decide to do that. I wish I had a mentor. Those Facebook pages or Facebook groups really did save me. They have a lot of information there, but if anybody needs any help, you just let me know.
So I will post your information, guys, on the video site as well. Okay. All right, guys. Thank you so much.
Right. Thank you. Good luck.
Okay. Take care. Bye-bye.